Hi, everyone. My name is Eric Kim, a breast imaging radiologist and clinical assistant professor at NYU. And today I'm here to talk about some of the barriers to screening mammography, which is especially relevant since it is currently Breast Cancer Awareness Month. So it's been shown that the early detection of breast cancer through screening mammography reduces breast cancer mortality. So while we know that screening mammography saves lives, we can't save lives if women aren't getting screened. And while screening use has drastically increased over the last 30 years, millions of women in our country are still not getting screened, and breast cancer remains the second leading cause of cancer-related deaths among women in the US. So various studies have been done to identify disparate patterns of screening mammography utilization so that we can target populations for screening education and intervention with the ultimate goal of improving mortality from breast cancer. Here at NYU, we looked into disparities of screening utilization, specifically at the city level in the United States. And we found that the factors affecting screening utilization are complex and multifactorial. As you may expect, factors including household income, insurance status, and the use of other preventative health services positively correlated with screening use. We also found geographic differences. For instance, we found that screening use was generally higher on the coastal areas, which also happen to be areas with overall higher levels of household income and insurance. While my study focused on urban areas, other studies have been done focusing on more rural areas, and they have generally shown that women who live in rural areas have lower rates of screening. These areas have fewer medical facilities and health services, so there's less accessibility to physicians and mammogram facilities, making it more difficult for women who live in these areas to get properly screened. It's important for us to continue looking into and addressing these issues of access so that all women are able to get screened. My study and multiple others have shown that women with lower household income are less likely to undergo screening. And this is one place in which I think it is important to educate patients on the potential costs of screening. The cost of a screening mammogram is fully covered by most insurance plans, including Medicare and Medicaid for women 40 and older. However, additional work needs to be done to reduce the cost for women who are called back for evaluation following their screening exams, since these diagnostic exams are not necessarily covered by insurance. Both our patients and referrers are confused due to conflicting guidelines regarding screening. The American College of Radiology, Society of Breast Imaging, and now the National Comprehensive Cancer Network are all on the same page. Women at average risk for breast cancer should receive an annual screening mammogram starting at the age of 40. However, some other groups currently recommend different guidelines. For instance, the US Preventative Services Task Force currently recommends biannual screening starting at the age of 50. Studies have generally shown that annual mammograms starting at age 40 has the most benefit in terms of reducing breast cancer mortality. So we need to work on unifying the guidelines across the board so that our patients are not confused about when they should get screening. Thank you for your attention.